Hello, my name is Christine Renee, and this is part two in my series of my weight loss journey, right? I'm so excited to talk to you about this because this is the part where I actually decided to have bariatric surgery and weight loss surgery, right? It goes by different names and there's different types of surgeries that you can have, right? I chose to have the gastric sleeve surgery, which is basically they go in and they cut your stomach and they make that a little bit smaller. There's another option, another surgery where they go around, around your I don't know if it's your something goes around your stomach or to your intestines or something. I'm not sure. I didn't choose that one. I chose the gastric sleeve because that seemed to be the safest for me and it kind of fit my thought process of how I wanted to do things. So the choice to have bariatric surgery or weight loss surgery was very easy for me. Um, I really I wasn't the type to do a lot of research, right? I'm not a huge research person when it when it comes to myself. When it's for everybody else and for something else, I definitely do research and I love to learn things. But for me, I was at the point where I was 240 pounds. And if you listen to part one, I had been 240 pounds when I was pregnant. And I was at that weight, but I was like, I have a baby. Like, that's why I'm this size. And this is just baby weight, right? It's just it never occurred to me that I would actually gain weight and be 240 pounds. Well, I ended up after giving birth to my child. So right now my child is 15 years old and I gave birth to her obviously 15 years ago. And she, I breastfed her. I did everything that you should do so that you can lose weight quickly and try and keep that weight off. And I did, right? I started losing weight and then of course I dieted in between there because I went to I had talked a little bit about the couple of different diets that I had done after I gave birth to my child. Um I did ideal protein and I did some of the shots, which I don't think it was Ozempic or Mounjaro. That's the other M1 that I was talking about. I don't remember what it was, and I will actually have to look that up. But I did go to my doctor and I said, "Hey, I know there's things out there that can work for weight loss, and I know that." I have tried these diets over and over and over again, and they're just not working for me anymore. And, of course, in my mind, in this day and age, we are all about a quick fix, right? That's what we want. We want something to be given to us or us taking something so that we can have the immediate turnaround, right? We send a text message on a phone and we want an immediate answer. It's the whole, it's the whole way that the world works at this point in time. And it just wasn't working for me. Like I wasn't getting the weight loss through the ideal protein like I did before, right? I immediately when I had my daughter, well, I shouldn't say immediately, but eventually when I had gained a bunch of weight back, I had done ideal protein or went through this program and it was great. It was fabulous. I lost so much weight. I have lost the same probably 70 pounds over and over and over again my entire life, right? It's so difficult when you've been through this process. Like if you've never been overweight and if you've always been a skinny mini or maybe you like I understand people that are skinny don't always have the best health either, right? I understand there's problems on that side too. So don't get me wrong, it's not all about that. It really is about health these days more so. But initially, it was all about weight loss, right? I wanted to look good. I wanted to be thin. I wanted to be pretty. I wanted to wear cute clothes. I wanted this, that, and this. So you go on a diet, right? That's the option. That's the option of what you do. You go on a diet. It was never back in the day, it was never, oh, let's go to the gym so that we can have good heart health. And you know what? Let's meditate so that we can have good mental health. And you know what? Let's make sure we're going to the doctor so that we know that our body in good working order, right? Well, I constantly was on a diet, right? Just forever. And so when I started gaining weight and was suddenly 240 pounds, when I, am not pregnant now, it's like, okay, it's time to do something. And so I did the ideal protein diet, which is basically, powdered packages and, this food and that food that I am buying from this program, which was great for the time being. And it worked for me for the time being. And I felt really good. I was thin. I did not have like any fat on my body. I do not know what my body composition was. So I don't know what the actual like real level of fat on my body was, but I was 145 pounds and I'd been 145 pounds before, way back in the day. I think before I moved to Massachusetts, so over 20 years ago, before I moved to Massachusetts and before I went to the police academy, I was like 155 pounds, 145 to 155 pounds. And I wasn't as thin as I was this time at 145 pounds. So when I was at 145 pounds after doing ideal protein, you could basically see my rib cage from my back. And I didn't like that. I really wasn't comfortable being that weight. Like I was like, you know what? I think it was like a size 7 at that weight. So basically I think my body needs to comfortably be between 155 and 165, somewhere around there. Preferably I like the 155, 160 area. But I think that, excuse me, 165 is totally appropriate. I'm 5'6". So, I feel good at that weight. I feel thin. I feel, like I can wear the clothes that I want because I do love presenting myself well. I love wearing cute clothes. I love having my nails done, as you can see. I love having my hair done. I love having makeup. I love having my lashes, right? I'm not vain per se, but I do enjoy looking beautiful, feeling beautiful. And it helps me in my own personal life, right? It makes me feel confident, makes me feel good about myself. It makes me feel like I can walk into that room and have people, glance my direction, be like, oh my God, who is she? And then I absolutely love when I tell somebody that I'm 50 years old and they're like, are you sure? They're like, you look 35. And I'm like, oh, thank you. You know what I mean? I love it. I really, really, really do. But so here I was, 240 pounds, went on the ideal protein diet, lost a bunch of weight over a period of 5 or so years. It took me a long time to start gaining this weight back because I still wasn't doing the things that I really needed to do. I wasn't making the lifestyle changes. I was just using the diet for the diet, right? To lose the weight and to feel healthier. At the time, when I lost the weight, I didn't need cholesterol medicine. I didn't need, I wasn't pre-diabetic. I didn't need some of the things that they were ready to put me on at 240 pounds. And so I did not go on cholesterol medication at that point in time. Later on down the road, when after the 5 years or so, I started gaining weight slowly, very slowly over a period of time, gaining weight, gaining weight, gaining weight. And I tried going back on ideal protein. It wouldn't work. So I ended up eventually going to the doctor asking to try one of the shots. Like I said, it wasn't Ozempic or Mounjaro. I can't remember what it was, but I did use it for, I can't remember, like a couple of cycles of getting the prescription refilled. Ended up really making me feel nauseous. You had to inject it and you injected it in your belly, and that was fine. I didn't have a problem with that, but it just didn't work for me because I ended up really feeling nauseous and I didn't like it. So at that point, I was like, okay, I need a new solution, right? Again, new solution, right? I'm looking for something outside the box. When the hard route, what I consider the hard route, going to the gym and eating right, just was not the answer, right? When it really should be part of the answer, right? Um, I realize that now, right? And I would still do it. Don't get me wrong. I would still go through the process of weight loss surgery. The process was amazing to me. And being here I'm in Massachusetts, I'm on the East Coast, and we have fabulous doctors here in this location. And the hospital that I went through was amazing, like just an amazing program. And they still support you every single day. And I am out of bariatric surgery 2.2 years. I had it in June of 2022. And so now a little bit longer now, 2 years, 3 months. And, I still feel great. I went back and looked at my numbers. So let me talk to you about my numbers. I went and wrote these down last night so I could confirm. So my weight prior, so history date, surgery date, 6/27/22. Hold on, there's a little thing on the screen. My initial weight, this was prior to surgery. This was a self-reported weight at the time, and it must have been because they didn't weigh me in at the time, on that particular day. So my initial weight was 238 pounds. Weight 1 month before surgery. So they basically weight loss surgery, they put you on a diet prior to weight loss surgery, and that is so that you can lose, you can allow I believe it's your kidney. Hold on. I wrote this down too, because I didn't want to get it wrong. Okay. It helps to reduce the size of the liver, so it's easier to perform surgery as well as getting into better eating habits. So I'll get into that a little bit more in a minute because I veered off here. But I decided to have the bariatric surgery. And like I said, again, I didn't change my mindset yet, right? I still haven't changed my mindset because I'm still thinking that it's a quick fix. I would still make the decision today, so don't get me wrong, because I had so many things happening at this time, like, it was kind of like, well, I was pre-diabetic, so my A1C levels were high, and I need to look those up because I don't recall what those numbers were, but they were high, so I was going down that route. My family is diabetic, right? My mother is a diabetic, my grandmother was diabetic, so it's there. So if I stay that weight, I am going to have issues. I had, acid reflux on a regular basis. I just didn't feel good. I was really overweight at 240 pounds, being my height at 240 pounds. Again, like I said, I'm 5'6". I would be bending over to tie my shoes and can't breathe or feel like, the acid reflux is just going to come up or, it just felt horrible. It just pushed and I was so uncomfortable and I couldn't deal with that. I was like, something has to be done and this is the route we're going to take. And I looked into it enough to say, yep, this looks good for me. So I went and spoke to my doctor and my primary care and I said, look, I already have issues with being pre-diabetic, right? I have a cholesterol problem at this point in time. So I needed to start taking cholesterol medication. So I did get myself on cholesterol medication. I do have a thyroid issue. So I have a hypothyroid, and I've had that since I was about 12 years old. That doesn't really help with weight loss, and it really keeps you kind of almost at a disadvantage for losing weight. I've always had issues losing weight. But again, I didn't have the mindset that we have these days, right? Like I could have been going to the gym my whole life. I could have been, I could have been eating properly my whole life, but these weren't the decisions that I made. So I went down a different path. Before, when I talked about being 155, 160 pounds before I went to the police academy, or before I moved to Massachusetts and then went to the police academy a few years later, I was at the gym every day. I lived in Ohio, and that was where I spent my time. I spent 2 hours at the gym doing whatever, like that was my focus, right? And so I've always known it can be done. and you see, right? You look at the world, you look at the magazines, you look at life, right? You see that people are going to the gym and they are living healthy lives, but it just wasn't prevalent in my world, right? Like the people around me weren't the people that were going to the gym and eating right and whatever, right? We were living different lifestyles. So when I went to the doctor and I spoke to her, and, based on all of the things that were going wrong with my body, all of the things that I spoke of, I have kidney, like my levels for my kidney were high, so I had to go have those checked out. But everything was kind of going downhill. And I was like, all right, I need to get healthy. Like now it's about health, because I was just getting older and older and older. I'm like, now we need to focus on health. We cannot be, focusing on anything else. Like, even though, yes, weight loss, yes, I want that for my goal. I still want to be about 20 pounds lighter. It's more about health and wellness now, right? Like has to be the focus. This is where the mindset change happens. Not as my kid, most likely. Stand by. Okay, she wants the dog. We're going to have to deal with that later. I'm recording. Sorry about that. So really focusing on health and wellness. So I spoke to my doctor. She gave me the option. She said, listen, these, you're going to go over here, basically the referral, go to this bariatric surgery. They have a program at a particular hospital. So that's what I did. I went and visited them. I had a consultation, and they basically walk you through everything that you need to know, everything you need to do. You have to do 1,000,010 different things before you can have this surgery. It's not just you walk in and you're like, I want to have surgery. And they're like, okay, let's hook you up. That's not how it works. They basically have to, you're like a car going into the auto body shop, and they look under the hood and they are checking absolutely everything out. I had to go have an EKG. I had to have blood tests run. I had to, they had to look at my cholesterol. They had to look at my kidney function. They had to look at, they looked at my esophagus and, all of my, the heartburn and whatnot. I ended up, you had to go through a psych eval, like a little, it wasn't necessarily a psych eval, like you're answering questions. You had to meet with, I don't know if it's a psychologist or whoever it was that you had to speak with them on the phone, because they had to make sure that you had the right mindset and thought process of going into this, right? Like they have to check with you and make sure that you are ready for this process and you're answering things appropriately, right? And you're willing to do the work. And that's also, when I talk about that pre-diet, that is also another reason for that pre-diet, is because they need to make sure that you are serious about really getting into doing this, for your own health and well-being, and that you're going to stick with it, right? So if you can diet, and if you can get done what you're supposed to do prior to the surgery, number one, you're losing weight, helping yourself out. Like I said, you're getting that liver down so that they have a better space to operate. And then, and then you're committed. You show your commitment, right? The other thing I had going on is I had something going on with my gallbladder. I didn't know what it was, and I didn't even realize it was my gallbladder until I had explained to, my doctor something had happened. I had gone somewhere with my kid, and I ended up eating something, and I felt awful. And the pain was underneath my right rib cage, and it made me feel so like nauseous and sick, and like I just didn't feel good at all every time I ate. So, I'm talking to my doctor about that. So I have now this problem, right? So I decided that I definitely wanted to do the surgery. I had the consultation, but in between my asking my doctor and going for the consultation, I went on some sort of cleanse with my sister. I did a cleanse with my sister, and I lost 10 pounds. So this was just a small period of time in between my consultation, talking to my doctor, and the consultation being set up. Let's say it was 2 or 3 weeks, and I went on a cleanse for probably about a week in between there. Well, in between that time frame, I lost 10 pounds. When I got to the consultation, they basically were like, "Well, you don't fit the bill for somebody who should have bariatric surgery because your body composition, whatever the weight ratio was, right? The body fat compared to whatever was like 0.1%, like zero point 0.1 off of where they needed to be. Let's just say, for sake of numbers, because I do not recall these numbers, let's say the number needed to be 50% body fat and up to get bariatric surgery. I was like 49.9. Okay. And I was like, you have got to be kidding me right now. Like, what? Like, are you shitting me? So, what they needed for me to qualify to have weight loss surgery was I needed to have diabetes, which I did not. I was pre diabetic. That doesn't count. And I also had to have sleep apnea. So, what I did, because I was like, I really want to have this surgery and I'm close to the percentage of weight. Yes, I did. I'm slightly below it right this minute, but I haven't been for the past few years. So I needed to have basically sleep apnea. I knew I snored. So I called my doctor and said, I need to have a sleep study done. And so we had the sleep study done, and that came back um, with severe sleep apnea. So that came back having severe sleep apnea. I was ordered a CPAP machine, and we got all that in the process. So that ended up, because I had sleep apnea and I also had sleep apnea, and the percentage was close enough, I guess, like, because I had the sleep apnea, I was able to get the surgery. So that really, thank God, helped me out. Not that I wanted sleep apnea, but clearly I had sleep apnea and I just was undiagnosed because I didn't even think about it, right? Like, you don't think about these things helping you out, or that you should really live with a CPAP machine so that you can, breathe properly at night so your heart's not stopping and all of these crazy things, right? You want to be healthy as possible. And so that ended up qualifying me for this surgery. So I go in to start the process, and this is when they tell you that you need to go have all of these things done, the EKG, the blood tests, the GERD study, or whatever it is, where they put you in this machine and they like kind of like not shake you up, but they make you go lay down. They stand you up. Because they're trying to watch you drink this drink, and they're trying to watch to see if once it goes down, where it comes back up in your esophagus, so they can determine the level of your GERD. And so I ended up having severe GERD. And I was like, oh my God. I felt like a car going into the auto body shop. And you know how they call you and they're like, oh yeah, you just bought it in for the brakes. They're like, oh yeah. By the way, you need new tires, your inspection sticker's expired, and you need a new windshield because there's a crack, and your whole engine needs to be replaced. That is exactly how I felt. I was like, "You have got to be kidding me." Like, I went in just to talk about weight loss, and they're and they're like, "By the way, we gotta take out your gallbladder because it's, having issues, and if we don't take it out, it's probably just gonna, cause you issues for the rest of your life." Awesome. By the way, you need to have surgery on your esophagus. They do like a little, they said they could, when they go in there for the surgery, basically this is the way I picture it. I have no idea if this is how it is. Do a little like whip stitch at the bottom so that you don't have the GERD, or, oh my God, yeah, I've been saying it like for the past 5 minutes. The, you know what I'm talking about, right? You know what I'm talking about, right? It makes you heartburn. Oh boy. So to have the heartburn, right? You don't have that if they do that little whip stitch thing, so it doesn't come up anymore. Um, I was diagnosed with the sleep apnea. What else did I have? My heart was fine, thank God. My blood pressure was fine, thank God. And I had started cholesterol medication. So I basically went in for like a complete overhaul. It really was a fairly amazing experience. And and then, the pre-diet that assisted with some of the breathing, right? It alleviated some of that prior to the surgery, and your surgery's coming up and you only have a few weeks to lose weight, and you're really sticking to everything you need to stick to. They're teaching you what to eat and how to go about that process, of losing the weight healthy, right? Making sure you're working out, making sure you're moving your body, and they really walk you through the process. They've got support meetings. It was amazing. It was one of the most amazing processes that I have ever been through. And actually, they still have support meetings for people that are post-op, and that is great. And I do still go to those meetings, especially now. And I will get back into the third part of my story, um, on part 3, because I do feel as though it is basically 3 parts, right? We had the pre-process, where is basically my whole life until I decided to have weight loss surgery. Then the process of deciding to have weight loss surgery and going through that process, which again was just amazing. And then what happened after weight loss surgery. So, um, definitely subscribe to this channel, because we're going to be doing a lot of things, and this is probably where I will post my programs. Granted, um, I have a program that's going to be coming up that I'm going to start in the next couple of weeks. It's going to be a 5-day program where we are talking about 3 days of sticking to um, your new way of eating, your new way of being yourself, and your mindset shift, right? But I will go into a lot more detail. Follow me over on Instagram. It's Christine Morse. I'm sorry, Christine Renee underscore. That is where to follow me over on Instagram. So Christine Renee underscore. On YouTube, obviously it is Christine Renee 88. But yeah. So it was just a fabulous process. And I ended up going from, I don't think I ever went through the weight completely. Let me tell you my numbers. So these are real numbers. I did not. Oh, okay. I don't know what I just did. Okay. So history. Initial weight 238 pounds. My weight 1 month before surgery, so this was during that pre diet time, was 225.4 pounds. And then I had the surgery in June of 2022. My lowest weight after surgery was, so June was my surgery, almost July. My lowest weight was 170 pounds, and that was in December of 22, December 22nd of 22. So 6 months later. And it took quite a while to actually lose all that weight, right? And one of the things about losing weight is that suddenly now you're a whole different person. You got to buy new clothes. You don't even know what to do with yourself. Like if you weren't the makeup, hair, confident person before, and now you've lost all this weight. Now you're dealing with either extra skin, or you're dealing with, you got to buy new clothes. Now you don't really know what to do with yourself. You don't know how to make yourself up. You don't know how to feel confident. That's a whole nother enchilada. And we will be talking about that as well, because that is one of my favorite things to talk about. Is I love the confidence piece, but we need to get back into bringing you that confidence after you've lost all this weight, right? And it's a fun thing to do. But so prior to all of this, I have had, and I wrote all this stuff down because these are part of my history, right? I had the hypothyroid. I talked to you guys about that. Hiatal hernia. That's what they called it, but it's to fix the GERD. Um, Partial hysterectomy. I had a bladder sling. So luckily I don't have to deal with any of that. Like, especially being overweight, there was no pressure, on to my bladder even more than it was, now. What I ended up having, I needed to have a partial hysterectomy because after I gave birth to my daughter, I ended up having a prolapsed uterus. So it was basically falling out, which was horrible. So they did a partial hysterectomy. So I still have my ovaries, but then they did then I did the bladder sling at the same time. So that helped. But I was pre-diabetic. I told you that. I also had a back surgery a few years ago, and that's primarily because of the job that I do, but it's also weight, right? You get heavy and then, your boobs are heavy and, everything's kind of off balance and you end up just having all of these pains, right? So things that cause pain, like weight, once you get rid of that, you can move easier. You have a lot less pain. But in the meantime, I ended up having to have surgery. So I had L4, L5 back surgery. That gallbladder, had that removed, had obstructive sleep apnea. I've had sciatica prior to my surgery. I still have sciatica. That's okay. That is definitely my spine and craziness. But it does go away, especially when I'm moving a lot. So I have found that over the last few weeks that when been working my butt off, like every single day working out, my sciatica doesn't hurt as bad, which is great. But I've always gone in and out of also having a vitamin D deficiency. So, and that can be winter or just location, right? Because I live on the East Coast. I used to live in California, so I used to get a lot more sun on a regular basis, maybe just a different job, right? Like I work in an office continuously. So, you know, vitamin D, a little bit deficiency there. So those are all pretty much all of the issues that I have had all over all these years. But a lot of those things were fixed having the weight loss surgery and weighing less and being more confident. And I do still take cholesterol medication. I don't know what my current levels are though. And I'm sure that if I were to lose that extra 20 pounds, that I could reconsider going back off of that medication, but we will see. That's all in due time. And I talk about losing that extra 20 pounds because weight loss surgery is not the end all be all. And that is for part 3. Again, lifestyle and mindset change are things that have to happen when we want to be the healthiest that we can be and we want to live the lifestyle that we really want, right? Like I want to weigh in between 165, 160, right? And that's the weight I want to be. That's the weight that my body wants to be. I love what I look like in my clothes then. I can wear a bikini then. I wear a bikini now and I'm 184 this morning, and that's fluctuated over the last month. Last 2 months prior to working out, right? Prior to going, okay, crap, this is going to be a little bit of a struggle for me. Like I started to gain a few pounds. So that's why I really want to talk to you about weight loss surgery not being the end all. It is a tool and we need to use it like a tool. But that means we also have to use the gym or movement of any sort, whether it's walking, whatever. But we also have to use food and we have to use that mindset change. So part 3 will be coming in, I don't know, a few days, few weeks, probably a few days. So keep an eye out here. Please subscribe to this channel. This is where I will be discussing all of these fabulous things from here on out. And you can follow me again over on Instagram at Christine Renee _ or subscribe here at Christine Renee 88. So I hope to talk to you again soon. And subscribe, ask questions in the comments if you wish. I will answer absolutely anything. Obviously, clearly, I'm being very candid with all of my past history and the struggles that I have seen and the struggles that I've been through. And, that's what I'm here for. I'm here to help and share. And sharing is how we learn from each other and how we make our own decisions, right? It's what you do when you sit and you talk to a friend, right? You ask a friend questions and see if, what their thoughts are. And if this decision, weight loss surgery, is the right decision for you. It was the right decision for me, and I am very glad that I did it, and I would do it again. So, but remember, it's a tool, just a tool. Anyways, I will chat with you later. So again, Christine Renee, I hope you have a great day. Bye. Let's see how to get out of here.